So a client with a grade 3 varicocele and varicocele pain has messaged me saying that he has had he has had two previous varicocele treatments, a ligation surgery with incision in the lower stomach area and also an embolization through the jugular vein. And then he says that the same thing, his old varicocele has reoccurred. Obviously, he's now having pain symptoms as well, and he's thinking of having another embolization procedure. So my answer to this specific situation is, and I've gotten this specific case from many clients actually, from many men who've actually undergone surgery and embolization previously. So my best advice for you is you have to realize two things. First is that these procedures aren't necessarily 100% effective. So you have to really and seriously consider if you really want to undergo these procedures again. They might not work again, and they might cause more damage than the good that they're going to do. So I would be very careful of beginning with these. So be very cautious. That's my first advice. My second advice is maybe there's a reason why your varicocele is redeveloping after these procedures, right? So my approach is really digging into exactly what the specific lifestyle risk factors for varicocele are and addressing them fully. There are specific risk factors for varicocele, and once you take care of those, the swelling reduces, the pain becomes cured, and there's some specific treatments that you can use to speed up alleviation of the symptoms and to actually help improve the vein strength and kind of alleviate some of the damage that's being done so that the veins can heal faster. So that's my advice for you. And so number one, be very cautious of undergoing another procedure, because next time there might be some permanent damage that's done. There might already be some permanent damage. The pain symptoms you're having may be not from the varicocele, but from the procedures they've undergone. And that's actually been the case for some of my clients. Unfortunately, sometimes you develop permanent pain. So be very cautious, and you gotta realize that these procedures, they're literally damaging the veins, right? The veins that are swollen, or whatever veins they target, right? These veins are damaged, cuts, ligated, filled with coils or specific agents. So you have to realize that there is some damage being done, and reversing that damage is usually impossible. So it's a permanent procedure. These are permanent procedures, and you have to be very cautious. And maybe you should be looking at your own lifestyle risk factors. Maybe you should be looking at all the other options that are, instead of focusing on surgery or embolization, right? I think it's a really interesting marketing thing that's going on, getting people focused on only surgery or only embolization. What about everything else that you can do, right? I think, so that's my focus. I call that natural treatment, because everything else you can do is really just, it's natural. It's like, it's what you do on a daily basis. So that's my answer for you.